Osteogenesis imperfecta, also called brittle bone disorder, implies that the bones were imperfectly formed and they break easily. Today on Sound Health, our focus is the management of this disease. I'm Olasumbo Modupe. Welcome to the show. Eight-year-old Jima Ekwegbalu was born with Osteogenesis Imperfecta, also known as brittle bone disease, a medical condition in which the patient's bones are too soft and break easily. At some point in time, Jima deformed all her limbs and could not walk on her feet.
Before she was born, the doctor told us that that was at 8 months that she was not active in the womb. So because of that, she advised that we should go by C-section for her delivery. Initially, we were like, no, why the C-section? Because my first child was a normal delivery. So she explained with those explanations that the sluggish movement of the baby, it was not all that convinced that all is well. So he booked us for the C-section appointment. On the 9th month we went and Gemma was born, but she kept on crying without stopping. So the doctors were like, what could cause such continuous crying? Though it's normal that a child can cry after birth, but not to that extent. So they started checking all her body. It was then they noticed that many of her limbs had fractured while inside. Even there was some of them that broke inside the womb. And because of that untreated fracture, they curved in one funny ways. So it was then the doctor told us that he's suspecting that she had Osteogenesis Imperfecta, but meanwhile he referred us to Lagos State Teaching Hospital. It was at Lagos State Teaching Hospital she was diagnosed properly 2 days after she was born.
As the only child with the incurable genetic disorder, our parents and doctors could not ascertain the reason behind the disease, as it is a rare condition in this part of the world.
In two forms. Some people can get it through inheritance. Then some other person can get it through what they call a spontaneous mutation. That is by chance, you understand? So, but Gemma's own is not by inheritance. I think it's on spontaneous mutation because it's not in our lineage. Yeah.
With the help of medications and surgery, our bone density and muscles have improved. You're watching Sound Health on Lagos Television. Today on the show, we are treating Osteogenesis Imperfecta, also known as brittle bone disorder. Dr. Adebayo Owoola, consultant pediatric orthopedic surgeon at the National Hospital Igbobi, will take us through how to manage brittle bone disorder. Welcome to the show, doctor.
Thank you.
Okay, what is brittle bone disorder?
Brittle bone disorder, like the name implies, brittle bone means the bones are brittle. That means the bones are easily breaking with very little trauma. It's a condition, that's just the layman's name for it. The medical name is Osteogenesis Imperfecta. And that name actually says it all. Osteo means bone. Genesis means formation. So formation of bone. Imperfecta is from English word imperfect. So it means imperfect bone formation. Now what happens is that the building block of the bone is called collagen, collagen 1, and this is either defective in terms of quantity or quality. So if you have a reduced amount of collagen in the body, or a defective collagen in the body, then the bone becomes brittle. It becomes easily breakable. It's just like when you want to make a brick. If you use a substandard cement or you use very little quantity of cement, you can easily break the bricks. So this is essentially the underlying problem in osteogenesis imperfecta. The collagen, which is the building block, which is the major component of the bone, does not form properly. And that's the reason why the bones break easily.
Okay, doctor, please share with us the reason behind the bones not forming properly. What causes brittle bone disorder?
The cause of this is actually not known. Why? It's just a genetic problem that occurs when the baby is being formed, and nobody knows why. Sometimes it can be familial, it can run in family. Sometimes it can just be by random mutation, which means it just occurs spontaneously. So nobody really knows. And when this occurs, then the brittle bone disease ensues.
Apart from fragile and bone deformities, what are the other symptoms?
Okay, the major symptom is that their bones break easily, which means a child that, children are always running around, playing, jumping. They don't break their bones like that. But these kids, when they have this disease, any little trauma, any little injury makes their bone to break easily. That's the major reason. So they can break their bones of the upper limb, can break the bone of the lower limb. Any of the bones can break. The other symptoms is some of them, not all of them, have a bluish sclera. The sclera is the white of our eye. That white becomes bluish. So that is one of the other symptoms we see when they are born. However, it is not in all of them. So it doesn't mean that if somebody doesn't have a blue sclera, it means he doesn't have it. He can. Some of them don't have it. Another thing they have is what we call dentinogenesis imperfecta. That's the teeth are not well formed. The same thing which happened to the bone is also happening to the teeth. The teeth also has some bony component, which is the dentine. The dentine is also made up of largely by collagen, which is what we said is defective. So if that defect is also there, the teeth are also not well formed. And you see the teeth, the teeth you are usually described as opalescent, like almost transparent and brownish. So those are the two other symptoms that you can actually see, apart from the fact that they break their bones easily.
Okay. Dr. Owoola, are there types of brittle bone disorder?
Yes, there are various classifications that we have in the literature. Mainly, we have 4 types, type 1 to 4. However, it's not that 1 is the best and 4 is the worst. The type 2 is actually the worst, and it's called the lethal variety, which means patients with this can actually be born dead. The child actually dies in utero, dies in the womb, because it's so severe that apart from the bones of the hand and the legs, the bones of the chest too also breaks. And the chest is what contains the heart and the lungs. And when those bones break, the child can't breathe properly in the womb, and it affects the heart. And so some of these children actually die before they are born. That's the most severe one. We also have type 3, type 4, and type 1. This just shows you the various types that we have. Okay, yeah. And type 1 is usually the least severe among them. Yeah.
How is the condition diagnosed?
Okay, this condition can actually be diagnosed even before the baby is born. Like I said, some of them are so bad, like the type 2, that you can actually see that the child is not growing properly. At a certain age, you expect that the bones of the thigh, which is the largest bone, should have a certain length. So by the time you keep looking at the baby, 3 months, 4, 5, 6 months, you don't see increase in the length of bone. You may suspect, or you may actually see the bones actually breaking in utero. In those ones that I said are the severe types. However, if it is not the severe types, as soon as the child is born, you can have a look at the sclera. It will be bluish for those who have bluish sclera. And then, so by the time the child starts to grow up, you find out that any little handling the child's bones start to break and the mother start getting worried, and they can actually come to the hospital as early as within a month of birth. So you find different bones breaking at different times. Some of those bones may actually have been broken during birth. You know, when the child is being born, the child is coming through a very narrow canal, and then at that time, some of those fractures actually occur, which ordinarily shouldn't occur anyway, but because the bones are brittle, they occur. And then when the child starts to grow up, and you know, children like to carry other little babies, they can actually drop them, and then you find out that they are coming in with different fractures in the legs, in the arms, and then those are the ways by which we make the diagnosis. Once we do x-rays and we examine them, we take a history, then the diagnosis will be obvious.
Okay, doctor, how common is brittle bone disorder in this part of the world?
Well, fortunately, it's not common in this part of the world. There are various incidences being quoted in the literature, but some say it's as low as 1 in about 15,000 births, to as low as 1 in 30,000 births. So it's not very common in this environment. And the ones that we see most are the least, are the ones that I said is the type 1, which is the least in terms of severity. The ones which is type 2, usually you won't even see them because the child will be born dead. And if nobody does any post-mortem for the child, you won't even know that that's it. So fortunately, it's not very common, but we see them occasionally once in a while. Okay,
doctor, permit me to cite an instance. A fetus was diagnosed at 7 months to have brittle bone disorder. What could have gone wrong?
It's about 7 months of after birth or
before birth.
Yes, that is what I just said about the type 2, which I said is the later type. Some of them have fractures even before the child is born, because our bones are actually formed even before we are born. I mean, by the 7th week of life, the bones start to form, okay? And then by about 11 weeks or 12 weeks, about 3 months, all the bones are already formed. So at this point in time, they can actually start breaking depending on the severity of the osteogenesis imperfecta that the child has. So it can actually be diagnosed even before the child is born when the mother goes for the routine ultrasound. Yeah.
Is brittle bone disorder the same as osteoporosis?
No, they are not. They are two different conditions entirely. Brittle bone disease is what I've just told you, but osteoporosis usually occurs in adults and especially in the elderly people where there is loss of mineralization in the bone. Some of those bones, and then because of aging, some other factors, disuse, injuries and others, so that can cause. So, but the underlying problem are completely different, but the manifestation is more or less the same. At that age, their bones also become soft. They can easily fall down and break, like you see elderly patients, especially women, 70 to 80 years of age, they fall down at home, very minor trauma, they can actually break their hips or break any of their bones.
What is the life expectancy of a person with brittle bone disorder?
The life expectancy would depend on the types. Like I said, the type 2 is very bad. That's the worst type. Usually they don't survive. They don't even survive pregnancy. And for those who survive pregnancy, they die very early because of the fractures in the rib cages. So they can't. So because of that, they find difficulty in breathing, and so they die easily. The ones that we say that survive are the type 1 and the type 4. So those ones, they can live to adulthood. However, they go through a lot of stress in life because any little injury, they break their bones. They are in the hospital today, they are out tomorrow, they are in the hospital tomorrow, they are out the day after. And so, but if they are caught early and they are handled very well, like I tell all my patients who have this condition, when they come, this is not the child you give to even a 10-year-old house help. This is a child that you have to handle yourself. I tell them, handle this baby like an egg. You don't want any injury. And some of them do well if they are not the bad types. And so what you need to tell them is to prevent fractures as much as possible. If you can prevent those fractures, then they can live to, you know, they can live to their full potentials. And mind you, this condition does not affect their brain. These, you know, children are usually very active, they are very intelligent, and they are very aware of their environment. So if they can do that, then they can have a normal lifespan.
Can brittle bone disorder be cured?
Unfortunately, it cannot be cured because it's a genetic problem that has already occurred in utero. However, they can be managed. The first thing we need to do, is, like I said, is to prevent fracture, which is the most important thing. Because once they start having fractures early in life, then it's like a vicious cycle. Because when you have a fracture and it heals, that heal is not perfect. The bones that are supposed to be completely straight is no longer straight. It's kind of bent. So that bend in the bone also predisposes the child to having another fracture again. And because when they have fractures, sometimes they can be immobilized in plaster of Paris cast. When you do surgery, they can't walk for some time. That bone not being used also makes the bone to be weaker again. So it's a kind of a vicious cycle. Already they have a disease which makes their bone break easily. The bone is bent after repeated fractures, and then you now immobilize them. The bone becomes even more weak. So the most important thing is to prevent those fractures. There are drugs that we can give them that will also make the bone to be stronger. So that also helps to reduce the incidence of fractures. And when those fractures occur, you fix them as soon as possible so that they can get back to their feet as soon as possible. So it can't be cured, but we can only manage them.
How do you stop brittle bone disorder?
Like I said, some of them have familial tendencies. If you have a first child that has brittle bone disease, there is a likelihood that your next child may have it and the next one may have it. So one thing you can do is what we call genetic counseling. You have to let the parents know about it and then let them take a decision whether they want to have another baby or not. And when they have another pregnancy, they can actually do ultrasound when the baby is not yet born to find out if the baby has it. And then they can take a decision, whatever they want to do with it. However, some of them, like I said, are sporadic. They just occur, even without any family history of Osteogenesis Imperfecta. Those ones you cannot prevent them. So there's nothing you can do, it just comes.
Okay, going forward now, doctor, what is the way forward for a child diagnosed of brittle bone disorder?
But the way to go is that the parents have to be educated, you know. They have to be made aware of what the condition is and how to go about managing it. These parents need a lot of support. Like I said, it can be very frustrating, you know, when your child can't even play like the other children. He can't run like the other children, he can't play football like the other children. It can actually be frustrating both for the parent as well as for the child. So we need a kind of support for these parents. So the parents have to be made aware of all this. And they need to also be counseled, like I said before, how to handle the baby. And going forward, when this baby has a fracture, it's not the kind of fracture you stay at home to treat. And it's not the kind of fracture you take to all these local bone setters to manage. You understand? Because they will complicate matters. And like we see a lot here already, even for those babies with normal bones, when they go there, they end up with very terrible infections, non-union, that means the bone doesn't heal, or abnormal healing, stiffness of joints. Sometimes they end up with gangrene. Gangrene means that the limbs become completely dead. And so you are faced with the choice of whether to save the limb or to save the life of the baby. And that's the reason why this hospital has been named a hospital where they cut hands and legs. But it's not every hand and leg that we cut. It's the ones that need to be amputated because the life of the patient is at risk. And of course, before that is done, the patient has to sign consent. We can't take it out without the patient consent, and even the patient has to pay for the operation. It's not free. So it's not something that, people out there should be aware. They should feel free to come to the National Hospital Igbobi. They should have no fear that their hands and legs are going to be cut. We don't do that, but however, if it comes to that, it's not a matter of you coming, we just grab you and take you into the theater. No. It's a whole lot of process. Sometimes two people have to sign a consent to be sure that you are aware of what we are saying. And you have to pay for the surgery, like I said. So it's not something that is so quick to do. So like this kind of patient, babies are not babies you take to all these local bone center. You come to the hospital straight, and you come to see the specialist so that they can adequately fix the bone as soon as possible, so that the child can get back to his or her feet as soon as possible.
Thank you so much for sharing your thought with us on how to manage brittle bone disorder.
Thank you for having me.
Okay, that has been Dr. Adebayo Owoola, consultant pediatric orthopedic surgeon at the National Hospital Igbobi, on how to manage brittle bone disorder. Sound health continues with trending and home essentials. Please stay with us. This is how far we can go on today's episode of Sound Health. Hope you've learned one or two things about brittle bone disorder, also known as Osteogenesis Imperfecta. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.